My name is Dr. Ramesh Hariharan. I'm Chief of Electrophysiology at Memorial Hermann Hospital and Director of a section of EP at University of Texas, the Government Medical School. The reason why cardiology in general is exploding as a specialty is because of electrophysiology. So that brings us in very close contact with personnel from industry on a daily basis. For years, we've been training technologists out of necessity. Over the years, I landed up training so many technologists that industry would call me and say, hey, we have these people who are kind of been out in the field but have not understood certain concepts. Can we send them to you, work alongside you? And then came up with the idea that, well, if we're doing this, we should formalize that process. And then that not only can provide industry training, but we can take on people who would be trained where industry can come and say, well, listen, this guy is already trained. We can take him on and we don't have to spend another year trying to get him up to speed. So that's what the original impetus to doing this. Generally speaking, people from industry are thought of as some kind of sales force. This is more of a technical sales force, but because they're not here to really sell any product, they need to be technically competent to be able to work alongside a cardiac electrophysiologist. You need somebody competent, who is safe, who can assess these devices and make appropriate programming changes necessary at the direction of an electrophysiologist. That takes a fair amount of time to learn, no matter what field the person has been in before. We thought there would be a huge opportunity in a university setting with a core group of 9 or 10 electrophysiologists with a very large volume of clinical cases where they not only learn the didactic portion of their learning, but also work alongside in the cath lab, watching cases every day. And our aim is to train people where they become attractive candidates for these industries to come and say, this guy is already trained. For us to specifically tune them up to what we need to do is going to be a lot easier than taking somebody green from college or some other degree. We're able to tailor their education so that they leave with the most optimal training for them. It works out to being about a 6-month course, and that's the minimum time it takes. We try to split the time between pacing concepts and defibrillation-based concepts and ablation-based concepts, and we have excellent, besides physician mentors, we have a director of education who's been a leader in his field, and again, a director of the ablation who's been a leader in her field as well. We have a separate school setup area where we have a simulator where they not only, obviously they can't work on the patient, they can see what's going on with the patient, but they don't get to actually work on the patient. But they have a simulator in the school where they can look at what we are trying to move catheters and position things elsewhere. We have an excellent program both for didactics, from the personnel standpoint, practical standpoint, and the feedback we've gotten from the students has been excellent.